All right, so welcome, ladies and gentlemen, and thank you for joining us for the fourth edition of the Fireside Chat. My name is Garrett McLaughlin. For those who might be new to this series, the Fireside Chat is a conversational type webinar where we connect with some of the best professionals in the running industry. This week we have Ryan Tisdall, who is a sports physical therapist from Novi, Michigan. But before we get started, let me cover a couple housekeeping items. First, silence any technology around you, just to make sure you get the most from this chat. Second, I highly recommend asking questions. Of course, there'll be specific items that we cover during this chat as was outlined in the registration. But at any point, if you have any questions related to running, injuries, breathing, anything related that you think Ryan can help you with, please feel free to drop a question in that chat box below. Lastly, if you cannot stay for the entire chat for whatever reason, or you just want to reflect back on this content at a later time, I will be sending the replay tomorrow at 11 a.m. Eastern time. So make sure you're checking your email and especially the spam folder, since it quite often can end up in there. So without further ado, Ryan, thanks for joining us on the Fireside Chat. How's everything going today?
Beautiful. Yeah. Thanks for having me. I was excited to do this. It's
No.
a long time coming now. It seems like we talked about this about a month ago and all of a sudden it's November 2nd. I was like, oh my gosh.
I know. Yeah, it's pretty funny too. So for everyone on here, I met Ryan. Honestly, it feels like years ago with how things have gone this year. I think it must have been January, February, even though I think it was in my mind, it feels like last year. And then luckily through our conversations, I knew breathing was a big thing that he focused on, some of his certifications and his areas of interest. So I thought he'd be a good person, since I hear from a lot of people on a regular basis, hey, how do I breathe? I have trouble breathing as I run, or people that just don't understand how breathing is connected to the core and posture and all these different areas. So definitely looking forward to shedding some light on that today.
Yeah, absolutely. Breathing's important. If you can't breathe, you cease to live. So that's just a minor detail there. Honestly, it kind of roots in the base of how I approach almost everything with physical therapy training. I did a lot of training through a company called the Postural Restoration Institute, and their primary focus is on correcting posture through correcting breathing mechanics when you get down to the root of it. And it's really changed how I look at human movement as a whole, and the body, and just how interdependent different regions of the body are on each other, and how a neck problem can be stemming from the way you breathe, or a foot problem can be stemming from your inability to control a pelvis or what have you, because again, the way you're breathing. So it's been pretty cool to see and kind of go through those hoops of learning and growing.
That's awesome. Yeah, definitely looking forward to the content today. So before we get started and kind of digging deep into breathing specifically, tell the people a little bit about you. I know you mentioned getting through this slide quickly and getting into the content, but we'd love to hear where you're from, a little bit about Kinesis as well. I know met you and your wife over there, which seems like an awesome facility. So kind of give us a background.
Yeah, absolutely. So I graduated from PT school, Grand Valley State University, with a doctorate in physical therapy back in 2014. In my first 5 years of practice, I worked in a sports ortho clinic. Wasn't typically what you would see when you go to a PT clinic. We had an awesome setup. It was a giant, basically, facility that was in a warehouse industrial type setting. That was basically half weight room, half turf. Then we had treatment tables. But it was just a normal practice in terms of we'd bill insurance. And for that reason, we kind of got caught in the unfortunate rat race of cranking patients through and having to keep up with certain overhead costs. And I started to find myself scrambling to try to be able to treat patients the way I wanted to treat, and kind of just getting my schedule overwhelmed with patients. The volume was just too much for what I felt people needed in terms of care and instruction. And so me and my wife talked it over, and after some time of planning and stocking away money, we decided to open up a place together. So my wife had been running a training company of her own since 2014. So we just kind of decided to join forces, and that's how we ended up opening this. So we opened up in June of 2019. So when COVID hit, we hadn't even been a year old. So it's been an interesting first year and a half of business, but I'm very proud to say we're still here and still going strong. So I'm very blessed and fortunate to do that.
Yeah.
In terms of my background, before PT school, I was in the field of sports performance training, worked as a sports performance coach. A large portion of what I did was instruction on running mechanics. We used a lot of Frappier acceleration and the acceleration treadmills, if any of you are familiar with that. Pretty gnarly treadmills that go up to like 30 miles an hour and 45-degree inclines, and they're pretty wild. I don't know if they're really that necessary to do all that stuff when it comes down to it, but they're pretty impressive treadmills. So come from a background in sports performance, an athlete myself. I actually played football. I was a much better track athlete than I was a football player. I wasn't really built for football, but I love football. So that's kind of where I went with my heart. And so, yeah, here we are today, sometime later.
So question before we get into the content, what did anything before you got into physical therapy, sports performance, did you ever recognize the role of breathing at that point? Or was it more so when you started to work with patients, take additional courses, that's when the light turned on?
Yeah, no, honestly, when I wish I would have known back then what I know now. I had no clue. I was kind of a grinder when I was younger through high school and playing football in college. It was just work hard, move weight, run fast, and it didn't really matter how you did it as long as you did it. And unfortunately, I learned through my own experience, it's not just like lifting technique. It's important how you move, what your mechanics are from a biomechanical standpoint in terms of health of your joints, but also your central nervous system and whatnot too, in terms of the benefits you're going to get from it. So yeah, unfortunately, I didn't get that training and understanding of postural alignment and effective respiration and breathing has on your posture and overall joint health until later in life.
Mm-hmm. So tell us a little bit from an anatomy and physiology standpoint, just what we need to think about or consider, and I guess what do most people miss when they're thinking about breathing in terms of anatomy?
Oh yeah, absolutely. So can we do a little screen share here? If I can pop up my app, I can walk people through this. It might make a little bit more sense, and we can come back to this.
Hopefully.
I know we had talked about trying this. If we got it, great. If it doesn't work, we'll make do without.
Let me see here. So can you, oh, here we go. Are you able to share now?
Let's see. Nope, it's saying only the host can.
Try that. I just switched the setting.
All right. Oh yeah. Start broadcast.
Awesome. There we go.
Very cool. All right. Let's get our central anatomy guy going. So a large portion of the issues I see people run into is when they think about postural alignment, the first thing they want to go for is perfect symmetry. But fortunately and unfortunately, our body wasn't created to be symmetrical. And it has to come down to the distribution of our organs and really how our lungs are designed. So obviously the heart sits a little bit more to the left. Because of that, our left lung only has 2 lobes versus the right having 3. And with this, we get a little bit different orientation of the diaphragm as well. So your liver sits underneath the right side of the diaphragm. So what I'm zooming in on right now is obviously thoracic rib cage, and I'm going to add in some musculature here. So I'm going to highlight our diaphragm here so everybody can see what this looks like. Most people don't realize how big this muscle actually is. It is a massive muscle. It sits on the inside of all your rib cage, and it actually extends all the way down to L3. So we call the cruce of the diaphragm extend down to your L3 vertebra. It's a pretty massive muscle, but because of where it touches, it has the ability to rotate your spine, pull up on the spine, and press down obviously on the abdominal viscera. So going back to how this functions and why this is important, our liver sits up on the right side, like I said, underneath the right side of our diaphragm here. if you look closely at the diaphragm, you'll see the right side actually is a little bit higher than the left. It's not super noticeable here, but if you take x-rays of people, you will see that. Now, what that does is it induces a little bit of rotation and makes our left lung a little bit more hyperinflated. In terms of how this functions, think of the diaphragm functioning as a water pump, okay? So just like a pump works to draw water in, your diaphragm draws air into the lungs by descending. So if we're looking at that diaphragm, when it contracts, it's actually going to move down. So you're going to see that diaphragm move down towards the pelvis. That draws air into the lungs, the rib cage expands. Okay, so what we're trying to create here is essentially a pressurized system. So what we get is we start to add in some more muscles here. This in the very front is what we call your transverse abdominis. Think of this as a front wall to a muscular canister. Okay. Underneath of it, we have our pelvic floor. So we're flipping up from down below. Think of that as the bottom of your canister. And if we go over here, we have another layer of our canister being our internal obliques. A lot of people get focused on the six-pack muscle being your rectus abdominis, but your transverse abdominis and your obliques wrap all the way around. And these muscles need to be working with your diaphragm to create a proper postural alignment and core contraction. So again, let's back up. As we take a breath in, our diaphragm descends. It draws air into your lungs. The rib cage is going to expand. As the diaphragm descends, it's going to press down on all your abdominal viscera. Okay, so all the organs, that's basically what that means. So all the organs in there. So as the diaphragm comes down, it compresses all the abdominal viscera. We now have what they call intra-abdominal pressure. So we have a pressurized system. Unfortunately, if we're not in the correct position, that pressurized system is no longer pressurized because we're going to have an energy leak because the muscles cannot be lined up to get what we call a neuroreflexive contraction. So what we commonly see with people is a altered breathing pattern where they start to extend through their lower back, or what we call an increased lumbar lordosis with an anterior pelvic tilt, and their rib cage starts to flare up. If we go back to the other slide here in a sec, what that does is it changes what's called the zone of apposition. So the zone of apposition is the area that the diaphragm is opposed or curved up against the rib cage. Okay, so let's move those out. So if I'm standing with my back super arched, okay, the rib cage starts to extend out, my diaphragm is going to flatten. Therefore, my diaphragm cannot engage properly to bring air in. So then I have to start using other muscles. And that's where we start to see this postural dysfunction, breathing problems, breathing dysfunction, and what have you. In terms of just the base of natural gas exchange, what we want to see is, or what we do see is obviously O2 coming in, CO2 going out. I don't know how far, Garrett, do you want me to go into that? I don't know that that's necessary for what we're going over today in terms of the gas exchange, but
yeah, I think that's great, especially being able to see that in front of us here. I'm curious if we can show the different postures so people can connect that to maybe their situation.
Yeah, absolutely. So why don't we end this screen share? We have some other slides there that are actually touching over that. So let me close out of the screen share here and we can keep moving along.
That was great. Good to see that. I mean, sometimes you hear about those things. It's really hard to connect with, I think, for a lot of people. So good to actually see those in front of us.
Yeah, absolutely. So even right here, if we look at that little image right down to the right, that was kind of what I was trying to explain in terms of that zone of apposition. So if we look here, the figure on the left, we have a nice curved diaphragm. So that little red line is representing the diaphragm there. The rib cage is pulled down nice and tight by your internal obliques, your transverse abdominis. Now, if we look at the guy to the right there, where we have an extended lumbar spine and also an extended thoracic spine here, we get a forward head posture, the rib cage starts to externally rotate, and that red line representing the diaphragm is now flattened out again. Okay, so as soon as the ribs start to move away, it pulls the diaphragm down, and now we don't have that zone of apposition. So the diaphragm is less able to help you breathe. So now we have to kick in all these accessory muscles for respiration.
So what things, so in terms of you saying kind of activate these accessory muscles, like how does someone know they're activating those or in a poor position?
Perfect. You want to just move on to the next one? We can start talking about the self-exam. We can come back to this guy. We'll come back here and talk about some core positions. So if you wanted to check out how you're breathing, I'm assuming most of us are sitting in chairs right now. I like to sit on the floor. So if you're on the floor, that's probably the best spot. Go ahead, lay flat on your back. Get comfortable. If you can throw your feet up on the couch so your hips and knees are bent to about 90 degrees, that would be optimal. Kind of allows your pelvis to come back underneath you and get you more lined up. If you're like me and you just feel like sitting in a chair, what we can do is you want to take your hand, place it at the upper part of your chest or the base of your neck. You want to take your other hand, make a C, and you're going to wrap it around your rib cage. So your lower rib cage right above your hip bone, almost like you're doing the I'm a little teapot position. Okay, so once you're in this position, I always encourage people to close their eyes so they can just focus on what they're feeling. And then take about 3 to 5 deeper breaths and just feel where you have movement at. So do you feel your upper hand moving? Do you feel your neck moving? Do you feel your lower hand expanding? Where do you feel the movement at? Also, where are you bringing the air in? Are you using your nose? Are you mouth breathing? Are you doing both? So that's also going to affect how you breathe and how you posture or posturally align yourself. So one thing I really commonly see is when people take a breath, especially deeper breaths, is an increase what we call a pump handle motion or upper chest movement. So the apical lobes of the lungs are getting inflated, and really a lot of engagement, again, through the scalene, sternocleidomastoid, pec minor, all these muscles we don't want to necessarily be using so much, just pulling up on the rib cage, and not as much movement going down at the lower rib cage or abdomen. The other thing I see people do is they've been taught to use their diaphragm by belly breathing. Mm-hmm. This is a problem. So belly breathing is inherently shutting off or learning to inhibit that transverse abdominis and your internal obliques that we just talked about through that Essential Anatomy app. Okay, so if you're taking a breath in and you're feeling the front of your hand just go way out, but your thumb's not going back at all, that means you're completely letting go of your abdominal muscles when you take a breath in. You're actually moving further into that extended pattern. Okay, if you're laying on the ground, what you'd feel is actually the arch of your back, or you feel your back lift up off the floor. We don't want that. That's not necessarily a good thing to see when we're taking a breath in. Something we can check if you have somebody with you after this, just have them take a picture of you from the side. I found this little image online when I was kind of prepping for this, and this is a good example of some different postures I see people in terms of their weight shift, their rib flare, and where they're lined up. If any of you are familiar with what a plumb line is, just like in carpentry, you want to drop a plumb line essentially down from your ear hole, okay, so the outside of your ear, and it should be dropping down through this mastoid process, straight through your shoulders, straight through the center of your hip, center of your knee joint, down to your ankle. And if you look at the image here to the right, you can see that this female here, her center of gravity is not in line with that plumb line until she's back against the wall. And she shows that pretty well here in terms of how that's going to affect the position of the rib cage relative to the pelvis. So getting that rib cage over the pelvis is extremely important for having an optimal postural alignment, but also core function. That's what we were trying to get at before. So Garrett, if we can back up a slide, we can kind of talk about that canister. Yeah, there we go. Perfect. So this is the example and metaphor I use with pretty much all my clients and patients is we want your core to function similar to a soda can. Okay, so if you think of a soda can, it's really flimsy aluminum. It's not a strong metal, but when it's closed and it's still pressurized, it's extremely strong. You can stand on it, you can load it up, you can stack a ton of weight on it, and it doesn't break. But as soon as you pop the top, it's flimsy aluminum. It can't withstand anything. A little child can crush it without any effort. Your core functions the same way. So if we get into a position where my diaphragm is no longer parallel, so lined up over my pelvic floor, I cannot get the neuroreflexive contractions of my pelvic floor muscles, my transverse abdominis, internal obliques, multifidi. These are extremely important muscles to create that muscular canister. So as we look kind of down this progression from left to right, you can see optimal on the left-hand side and suboptimal on the right-hand side. And those different postures that people get into or fall into, and a lot of it I see is just from a poor respiratory pattern or dysfunctional breathing that they've learned to accommodate, or they feel comfortable breathing a certain way.
So I guess big question is, I mean, I see people in these different positions all the time, and you're here, oh, I went here and they told me I just need to stretch my hip flexors. I need to stretch my pec and do a doorway stretch. My neck is tight, so I do some of this. How much of an impact can we have on posture, tightness, all those different things if we're not actually addressing breathing in the process?
Yeah, great question. So I used to be one of those therapists that practice that way. So the next question in that process is, okay, why is your pec tight? So sure, you have a tight pec. That's part, I'm not saying it's not tight, but why is it becoming tight and why is it habitually tight? Why are you constantly having to stretch it out? And that's because you're using your pec minor to pull up on your rib cage. Or if your hip flexor, we're constantly stretching your hip flexor out. Why is it so tight? Because you're using your hip flexor to pull your spine into extension to create stability across the lumbopelvic junction there. So until we address the underlying why of why that muscle is tight, we're not going to, stretching it might be a way to inhibit it temporarily, but it's not going to be a fix-all for that issue.
Mm-hmm. So that's great. That's great. And so how often do you see, and it's, from the sounds of it, I mean, it sounds like something that's very common, especially with the lifestyles that we've adapted. How often, if you had to say out of 10 patients that you see, how many of them are working on breathing? Because I mean, it's kind of safe to assume most everyone should be having some kind of exercise or drills to address that, correct?
Yeah, I would definitely say so. Literally every single person that comes into our facility, whether they're there for physical therapy or they're there just for training, I guarantee they're doing some exercises incorporating breathing and focusing on a proper core contraction and alignment while they're breathing. And the number of people that actually work on that when they come into my clinic, I can't tell you if I've actually had anybody. I think I've had one patient, and unfortunately, well, actually, she wasn't my patient. She's my wife's client. She's a singer, and she was taught to belly breathe, to use her diaphragm. So she also has a scoliosis. So you can see that belly breathing is not really helping her back out in any way in terms of creating a good abdominal canister or muscular canister to stabilize her spine.
Mm-hmm. And so you mentioned breathing, also core. A lot of people doing some kind of core training. You'll typically see sit-ups, crunches, the traditional style of core training. Like, in your mind, what should people be focusing on more so than what they see in magazines or common box gyms?
Absolutely, yeah. So one of my favorite things to say is every exercise is a core exercise. Mm-hmm. My clients, I think, get a little bit annoyed with me. But it's true. If you're doing every exercise with an intentional focus on how you're breathing and the postural alignment, is your rib cage stacked over top of your pelvis the right way, every exercise has now become a core exercise. And the amount of time you need to spend actually doing core exercises significantly decreases. You don't really need to be doing sit-ups. You don't need to be doing all this other extra stuff to strengthen your core, if you're lining yourself up in the proper position, you're going to be strengthening your core while you're doing your other work. It doesn't have to be sit-ups on the ground per se.
Okay. Jeez, that's good to know. Especially save people a lot of time, hopefully. But when
Yeah.
when they are doing, and because you see a lot of people doing planks and things, again, it's more
Oh,
so
yeah.
it's more, again, being in the right position rather than holding it endless for time. Because I see you see all these plank challenges now, hold for a minute. I mean, there's a guy that held it for who knows how long he held it for. It was like hours or something crazy. How effective can a shorter core exercise be when you're in the right position rather than forcing yourself for minutes and minutes on end?
Oh, absolutely. Yeah, that's a great point. Actually, I had unfortunately a young athlete. She was coming into me for back pain, and she was a swimmer, and a lot of her pain was driven from the dry land training they were doing. So we started talking about, okay, what are you doing for your dry land training? What's going on? And she's like, oh, we do planks. We hold a plank for about 3 minutes. And as soon as she said that, for me, that's a red flag. Okay, let's let's get down and talk about what your plank looks like and how we hold that. And really what she was getting into was such extreme lumbar lordosis and anterior tilt. She was holding that plank for 3 minutes, but she was holding it by impinging her lumbar spine. So the facet joints are just running into each other. Her paraspinals were ramped up, and that's where she was getting her stability from. So as soon as I got her into a correct plank position, the max amount of time she could hold it was about 15 seconds.
Oh, wow.
Now that is not good. She should be able to hold it longer than that. But if you are not in the correct postural alignment, you may be actually harming yourself and not actually doing a quote unquote exercise to make yourself better or stronger. That's something I see a lot, especially with planks, push-ups, a lot of those closed chain exercises there. People get too focused on more is better instead of less is actually more if you're in the right position.
That's awesome. That's awesome. So how does this relate to running? Obviously, everyone in here is trying to improve performance, reduce their likelihood of injury, hope maybe recover from injury. How do we connect the dots to running?
Yeah, absolutely. Why don't we just start at the top of the list here in terms of metabolic systems. Obviously, if you can't get oxygen in and you can't get CO2 out, your ability to stay within your aerobic capacity is going to be significantly decreased. So if we do not have an optimal alignment, again, with your pelvis underneath you and your rib cage stacked over that pelvis when you're running, we're going to have a flattened diaphragm. I'm just re-hitting some points here for people. And you're going to have to use accessory muscles to breathe. So we're going to have very shallow breathing, meaning you're not going to be fully emptying all the CO2 or getting dead air essentially out of your lungs and basically getting the most optimal breath of O2 back in. So your ability to stay below that anaerobic threshold is going to be significantly decreased if we do not have you in a good postural alignment or core alignment for breathing. In terms of how that's going to relate to your mechanics, if we're looking at just the simple, straightforward anterior pelvic tilt with that lumbar lordosis, we've already altered length tension relationships. I mean, we can go anywhere up the chain or down the chain. If we're talking running, so many lower extremity injuries, whether it's hip flexors, FAI, so femoral acetabular impingement, hamstring strains, IT band syndrome, runner's knee. As soon as we get out of that position, it's not a matter of what the injury is, it's a matter of what tissue is going to break down first. So I have a lot of runners come into my clinic and they get really focused on, okay, I have a strained hamstring or I have patellofemoral pain or what have you, a quad strain. It's not necessarily so much the injury that needs to be rehabbed, but the question is, why did that injury occur? If it wasn't an acute injury, like it wasn't like a rolled ankle or something. So what are we doing over and over in terms of your biomechanical alignment that's predisposing and placing too much stress on these tissues? So that's where we got to get. So again, if we have that increased anterior pelvic tilt with the lumbar lordosis, because that's the breathing pattern we've adopted, what I'd call a PEC pattern. The question is not if you're going to get injured, it's what and when. And obviously, in terms of efficiency, that's not where we want to be.
How are people adopting these patterns? Is it lifestyle now, since we're thinking most people at a desk are sitting at a computer, driving, working, or like, what do you think are the causes for this?
I think it's multifactorial, to be honest. I don't think it's as much just the only sitting at a desk, or just to say it's only people are driving instead of walking. I think it has a lot to do with a lack of variety of movement. So a lot of us, when we have the chance to go for a workout, it's like, okay, I gotta burn my 400 calories, so I hop on the treadmill and I run, or whatever. I have to hit my 5 miles, so I get on the treadmill and I run my 5 miles, and I'm off and I'm out. And it's these continual patterns of the same things I'm doing over and over and over again that aren't necessarily challenging, not just my body to move different ways, but more so your central nervous system to coordinate movement patterns, to allow you to move differently. I think that puts people really at risk of being stuck in certain patterns and certain mechanics, and certain movement patterns really being underdeveloped, not necessarily muscles being underdeveloped, but more so the ability to utilize certain movements to be underdeveloped.
That's awesome. Yeah, that's actually something I never touched on it that way. That's something I've spoken about to a lot of runners that consistently run the same pace, the same mileage. They don't mix things up, don't add strength training. There's no faster running, slower running, and things in between. They really lack that variability. But, I mean, that's great to hear you say it from that perspective.
Yeah, I personally, when I talk to runners, I try to convey that same thing like you just said to them. Is like, okay, you can be a one speed bike, like a bicycle you grew up on as a kid. There's no gears, and that's the only gear you got. Or you can be like a 21 speed bicycle, and you can sprint, you can go long, you can go far, you can go up hills. That's what you want to be an effective runner. You want to be that 21 speed. You don't want to be just one gear.
Mm-hmm. That's awesome. And so, like, looking at these images right here, you see two very different runners, and from an alignment standpoint. The guy on the left, obviously, you only see part of him, but he looks like he's very stacked and aligned, and you'd assume he's efficient just looking at the position. And the woman on the right, which I see a lot of when we look at knees collapsing in, pelvis dropping, and I'm assuming something there that breathing, in addition to some stability training, would go a long way. And since, I mean, something that I see a lot with the runners that I'm working with, correct?
Oh yeah, absolutely. That's why I chose these two pictures. Yeah, unfortunately, a woman on the right, I mean, you hit it. Knee valgus with the femoral adduction, internal rotation, pelvic drop. You can see the lumbar side bend right there. I don't know if people can see, but if you can look a little bit further down the chain, you'd see how pronated her foot actually is, and her ankle's really everted too. So again, and when I look at a picture like that, somebody said, "Oh, what do you think's wrong with her?" I'd say, "Well, it just what tissue got irritated first. It's just a matter of what. These could be so many different things, whether it's a QL strain, a low back strain, FAI, piriformis syndrome. I mean, you could go all the way through and just pick out so many different things. So for someone like her, again, going back to the foundational stuff, we used to always say core strength was so important, but I didn't really understand necessarily what that meant. Again, your core is your foundation, but it's not necessarily being strong. It's being strong in the right position. So again, like we talked about with the plank, sure, you can hold a plank for 3 minutes, but you're holding a plank in a very bad position for 3 minutes. That's not necessarily going to allow you to maintain optimal biomechanical alignment. So it's learning to be able to coordinate your breathing with your core, so you can maintain optimal length tension relationships and get proper, again, what we call neuroreflexive contractions of these muscles, so we can get into the right movement patterns.
Mm-hmm. I mean, something you said there, I think really resonated with me. I have a lot of people, because I'm certified in active release techniques over the years, I've had people reach out specifically saying, hey, uh, I have plantar fasciitis. Last time I treated my foot with active release techniques, my pain went away. Can you treat me? And we see these recurrent injuries month after month, year after year, come back years later, but are never truly resolved because we're always looking at that was just the one irritated tissue at the time, rather than it being nothing was corrected in the process of that rehab. Does that sound correct?
Oh yeah, I agree with you. I think Garrett, for me and you, our job is more of like detective work. It's asking why are we seeing this, and too many times I think the medical community, trainers, what have you, it's just very easy to look at. Okay, you got a tight calf or your foot hurts. Let's treat the symptoms. We can do some work on your calf. We can work on your plantar fascia. Oh, your symptoms are gone, great. Instead of, okay, we need to take a look at your running mechanics. We need to take a look at how you hit the ground in terms of your foot strike. We need to look at the position of your pelvis while you're running to see if that's changing, why your foot is hitting out in front of you. Are we too extended through our spine? Is that why our foot's coming down too prematurely? And that's why you're too far on your forefoot. That's why we're seeing plantar fasciitis. I think for us, being able to kind of piece that back is so important. And in terms of looking at how people are able to breathe or not breathe is a really integral piece of that.
That's awesome. So I want to start getting wrapped up here, just because we have a few questions, a couple sitting in the chat right now. So make sure we get to those. If people, before we get into the Q&A here, I mean, for those of you that are hanging out here, got a good crowd listening on right now, watching, feel free to drop a comment or a question in there right now so we can ask Ryan as we start to wrap up. How can people get in touch with you? I guess it's kind of on the screen there. What's the best way for them to connect with you if they have questions, if they have needs after they watch this Fireside Chat?
Yeah, give me a phone call, shoot me an email, either one, whatever you prefer. Check us out on Instagram. Don't message me on Instagram. I'm terrible with social media. Call me or shoot me an email. I'll respond to you. The other ones, man, I'm awful on Facebook and Instagram. But yeah, more than happy to chat. I love talking shop. So absolutely.
Awesome. So let me get into a couple of questions here. Scott asked, I have heard that odd breathing, I think this is something we spoke about as well. Odd breathing is better than 2-2 breathing. So I guess if you're trying to coordinate breathing on specific foot strikes or when you should breathe,
right.
What does that matter?
I agree. I think the rhythmic breathing, if you're doing odd numbers, it kind of allows you to make sure you're alternating your foot strike patterns. And that's a whole nother topic of discussion, because the idea behind the rhythmic breathing comes down to, okay, when you exhale, because of the air leaving your lungs and the diaphragm ascending, so coming back up, we now have a loss of intra-abdominal pressure. Okay, so now our core is less stable. Now, I would definitely agree with that if we're not in a quote-unquote optimal alignment. So if we're not in an optimal alignment, 100%, you're going to see a loss of stability there as you exhale. So I would say I agree with the odd number being a little bit better for that. But if we're, again, lined up the right way, and you can actually use a forceful exhalation to engage your IOs and TAs, so it's not necessarily so passive, you can actually create some force through your core. If you look at sprinters, when they take off out of the blocks, there's a nice exhale there. Or tennis players, when they hit a ball, they always scream. It's obnoxious to watch, but there's a reason why they're doing that. So I think sometimes when you're running, if you're feeling like your breath stacking or you're really short of breath, I think getting a good exhale back in, one, will clear out kind of that dead air. It'll also help bring your pelvis back underneath your rib cage. I saw earlier somebody had questioned about hill breathing. Mm-hmm. So how they would breathe when to go up a hill. And that would be something I utilize when I'm going up hills, is really a nice forceful exhalation on my foot strike. And again, trying to do that rhythmic breathing with that. So a pattern of 3. So it's right, left, right, left, or whatever it may be. So you're alternating each time you hit.
Do you think a lot of people, I feel like, say they have trouble breathing and always try to improve their breathing while running? How important is it to work on exercises, drills in a controlled environment first, teach proper breathing there, rather than going to, which I see running as, it's a more extreme, intense environment. It's probably harder to do it properly if you can't do it well.
Yeah, no, I completely agree with that. Yeah, absolutely. A perfect example of that is just the inability to breathe, do nasal breathing. So I know growing up, I was always told, oh, in through your nose, out through your mouth. Well, anybody who's ever ran hard knows it's like impossible. You cannot do that. You cannot meet the demand of oxygen by just breathing through your nose. So learning to do what we call like nasal oral breathing. So you're breathing both in through your nose and your mouth simultaneous when you're running, to help get some of that nitric oxide down into your lungs for gas exchange and to vasodilate. So again, make the capillaries a little bit bigger so we can get the O2 and CO2 going back and forth better. That's what we want to see. However, if you are unable to just, again, get yourself lined up in a correct postural position with, let's just say, something as simple as a single leg squat and breathe correctly that way, there's no way you're going to do it in a high threshold activity like running.
Mm-hmm. Mm-hmm. Yeah, so that's a good point right there. And I guess something, not someone's question, but my own, how important is it to maintain your breathing while exercising? I see a lot of people, they get in certain positions and instantly they're holding their breath, their face is turning red, and you're like, okay, to me, it's kind of a red flag. Is that the limit we need to push our bodies to? Or is that just a sign, hey, we've taken things too far, we need to take a step back?
I think you could use it either way. Again, I think it'd be more client specific of where you feel like you need to push them to. For example, I have one guy who's got a history of a bunch of hernias. I do not want to push him to a point where I see him doing that Valsalva, face turning red, holding his breath, because he creates core stability by intra-abdominal pressure from holding his breath. I work with him. I have him actually exhale through a straw and blow out to help regulate that pressure, to engage his IOs and TA, to get that core canister, that muscular canister that we want to see. I think being able to maintain your breath while you're doing, whether it's resistance training or you're just doing some body weight calisthenic stuff, it adds another whole level of intentional focus to what you're doing. So I'm sure plenty of you out there do yoga. They're very big on breath. I love yoga for that reason. And it definitely changes the game in terms of your intentional focus to what you're doing.
Okay. And then Jen asks any additional tips for breathing during strength training? I know we hear sometimes breathe in as you get to the harder part of the movement, breathe out as you're push, whatever it is. Is there a certain way to breathe with strength training?
Yeah, so I honestly, I cue most of my clients to breathe out on the hardest part of the movement, which is a little bit different. Again, it has to do with that intra-abdominal pressure and alignment. So for example, as somebody is coming out of a descent of a squat, I typically have them blow out to give a good exhale to help facilitate, again, your internal oblique, your transverse abdominis. They pull down on the rib cage, they squeeze everything out to help force that exhale back out, but it also realigns the pelvis underneath the rib cage there. Another thing I do is I'll actually have somebody exhale through the entire movement, especially something like a squat. So if somebody has a really hard time controlling a pelvic tilt, I'll have them exhale through the entire movement of down and up, again, because it helps them neurologically recruit the right muscles to maintain their pelvis where it's supposed to be. And again, just from a safety standpoint, I think it allows you to regulate your pressure a little bit better. So if you're somebody who's had a hernia or a history of hernia, or you're a female with some pelvic floor stuff, you absolutely want to be exhaling when you're doing this. If you're not and you got a big anterior pelvic tilt, you're just going to be really pushing on your pelvic floor. So you don't want to be doing that.
Yeah, so that's great. It's great information. What would you say are some ways Kevin Mays, to monitor and correct breathing during running? Is there a way just to assess that and to determine, hey, how well am I doing?
Uh, that's a great question. I think you could rely on something like either a pulse ox. You could check your heart rate monitor. There's some cool apps on the iWatches, and just kind of see what your cardiovascular response is to a certain pace of running. So let's say you're running a 7-minute mile pace or 8-minute mile pace, and see kind of what your cardiovascular response is there. And you could implement some different breathing techniques. Try that nasal oral breathing when you're running, to see if you can actually breathe in through your nose and your mouth simultaneously with a nice relaxed face, and kind of use your heart rate to give you feedback. So obviously, if you're not getting enough oxygen in, or as much oxygen in, your heart rate is going to have to increase to circulate more oxygen through your body, versus if you're getting a sufficient amount of oxygen in, your heart rate can stay a little bit lower. That'd be one way I would try to check it. Trying to think there's any other great ways to get feedback. For me, I know my breathing's off when my back cramps up when I'm running. That's an instant indicator that I am out of alignment. I am flared rib cage. Yeah, absolutely. So that would be another indicator.
So you also mentioned, again, the oxygen, CO2, and someone asked the question of, when I'm breathing during runs, how do I not have her super red face? So she feels like she gets super, I mean, this is Nashville, Tennessee, granted, so it's pretty hot and humid down there, but always feels like she gets overheated, her face turns red, she has difficulty breathing. Is that a sign that could potentially be a breathing issue?
I have, honestly, I'm gonna shoot you straight. I wouldn't think so. I think some people like tend to be a little bit rosier when they do exercise. I'm one of those. I don't know if that would necessarily be linked to breathing per se. It's not the same type of red face that we see from that Valsalva, like we were talking about before, where it's induced from increased pressure. I don't know about the rosacea type stuff going on.
Okay. Yeah, just curious. I thought it was kind of relevant to some things you said there. I
Yeah.
usually ask, how do we start retraining ourselves on correct breathing? Where do we start?
Yeah. So some of my favorite things to do are what's called a 4-point belly lift, or a wall supported squat. I'm trying to think if there's some ways we can show you guys these. Even laying on your back, like we did that assessment earlier. We could kind of talk through a 90-90 hip lift there. But if you lay down the ground on your back and threw your feet up, either flat on a wall or threw your feet up on a couch, so that your hips and knees are bent to about 90 degrees. What I like to use with people is a straw, and I have them breathe in through their mouths and forcefully exhale out through that straw. That helps, again, engage the IOs and TAs. But while they're doing this, I bring intentional focus to what they feel between their back and the floor. Okay, so what you want to feel when you take a breath in, you want to actually feel your back increase in contact with the floor. That means we have circumferential expansion through your core. Okay, what we don't want is that belly breathing where your belly just kind of bulges forward. We're letting go of our IOs and TAs when we do that. Typically, when I have people in that position too, I'll have them pull down with their heels, whether it's again feet on the wall, and imagining like they're pulling the wall into the floor, or if their feet are up on a couch, pulling the couch into the floor to help engage the hamstrings, again, to help kind of pull the pelvis back into a more neutral position. But that's where I typically start with people, is laying flat on their back, again, in through the nose, out through their mouth, put a straw in their mouth to help facilitate proper engagement of IOs and TAs, and an intentional focus to what they're feeling in terms of the contact between their back and the floor.
How far do you take this? So obviously that's a good maybe first step for someone, or, I mean, can someone realistically continue to do that exercise, do it well, work on it most days, months, and years, and be okay? Or do they need to progress that drill like you would other exercises?
Nope, that I would progress from there. So that would depend on what their specific need is, whether they need some single leg stance stability with some breathing. I'm kind of going off of more of my Posture Restoration Institute training stuff with that. But obviously laying on your back supine is pretty low level, not demanding. But getting them vertical and weight bearing supported. So leaning against a wall, like I kind of mentioned earlier, a supported wall squat, and breathing in that position versus an unsupported weight bearing position versus a single leg stance, unsupported position. There's a lot of different steps and progressions you can kind of go through doing that. But if you wanted more information, you can, we actually have a YouTube channel. You could check out our YouTube channel. Some of those exercises are on there. But if you YouTube the Postural Restoration Institute, I think you should be able to find some of those exercises to kind of get you started off on the right track and breathing and whatnot.
Awesome. And so last question here, Kevin had another one, and we'll wrap up on this tonight since I know it took quite a bit of your time, but great content because everyone is still hanging out here. So, that's when things go pretty well. So, Kevin, I hear different opinions on whether to run with a slight lean forward or versus upright. Are either of these better for facilitating breathing or better breathing?
Yeah, that's a great question. So from what I've been taught and what I learned when I was a performance coach and we did a lot of running mechanics, we were always taught a 10-degree trunk lean. So forward when you're at what we call terminal velocity. So meaning you're not speeding up anymore. You're just maintaining a speed. That forward lean is essentially allowing you to maintain a controlled fall when you're running. So we want your foot coming down basically underneath your center of gravity. If you're completely upright, I think people have a tendency to kind of heel strike out in front of them. It's just learning to maintain that 10 degree of forward lean without getting into that extended lumbar lordosis or anterior pelvic tilt. I think a lot of people, they tend to lean forward and they stick their chest out, but their hips start to lag behind them, and we see that extended position there. I absolutely 100% see that extended position when people are too tall when they're running, meaning they're pinned straight up and down. Obviously, the faster you're going, the more lean you're going to have, but somewhere around 10 degrees, like I said, for that terminal velocity.
Awesome. Great information. No, that sounds great. Well, we appreciate you taking some time to teach us about breathing, running, posture, core, everything here in this. Definitely kind of opened my eyes. A light bulb went off a few times just thinking of some of the clients I'm working with. We always tend to think about rib cage position, exhale, those things, but I think sometimes forget how it can relate to so many different things. So it's definitely enlightening. But I just want to say thank you for taking the time to speak with us. And if anyone else has any additional questions for Ryan, feel free, email, website, phone number here, get in touch with him. I know especially now needing to do a lot of things virtually, regardless of where you are, I'm sure he can help you out in some way, do an assessment and kind of get you on track with that if you're wondering if you're breathing well. So Ryan, thank you. Everyone else,
Yeah.
You guys have a great rest of your night. And it's been great.
Thanks for having me.
We'll talk soon. Thanks, Ryan.
All right. Have a good one.